Has any one of you ever had a family member or a loved one who became addicted to drugs or alcohol? I have. My mother is an addict, and I myself am also an addict in recovery. Addiction is a nationwide epidemic that needs more attention, and education should be available to the public. As an addict in recovery, I am very passionate about the subject, and I want others to understand the seriousness of the disease. 40 million Americans aged 12 and older abuse or are addicted to alcohol, drugs, or nicotine. Addiction exacts more than $700 billion annually in costs related to crime, lost work productivity, and healthcare. So many individuals partake in dangerous use of drugs and other addictive substances. As the usage progresses, some will develop an addiction. This disease does not discriminate due to race, gender, economic status, or age. Not everyone who engages in the use of drugs or alcohol will become an addict, but no one is exempt. Some of the risk factors for addiction are beginning alcohol or drug use at an early age, behavioral issues such as depression, anxiety, stress, personality disorders, trauma, sexual abuse, emotional abuse, and other psychiatric disorders. Genetic predisposition accounts for 50 to 75% of addiction. But please understand that having one or more of these risk factors does not necessarily mean that a person will become an addict. When addiction remains untreated, it contributes to and causes all types of medical conditions, such as pancreatitis, accidents and trauma, stroke, cirrhosis, heart disease, pregnancy complications, and miscarriage, HIV, hepatitis, and even death. Drug and alcohol abuse cause more than 20% of all deaths in the U.S. each year. Another widespread issue in the face of addiction is prescription drug use. Many people will get hooked on prescription meds without even realizing it. A lot of times we don't relate prescriptions to illegal drug use because they are prescribed by a doctor. But the more you use them, and especially if you don't follow the directions and use them as prescribed, the more dependent one becomes on the drug and the more one has to use to get the same effect. By this time, a person is already addicted. Prescription drugs include morphine, codeine, and methadone, just to name a few. The effects of these types of drugs include constipation, impairment, confusion, loss of consciousness, dry mouth, weakness, nausea, drowsiness, and more. Addiction does not have to be a death sentence for those affected by it. Programs such as DARE and other awareness about drug dependence should be a required class in all high schools. Students may tend to do what they see their friends do in an attempt to fit in. Peer pressure. Treatment should not be an option for those individuals who are incarcerated due to crimes committed during addiction. Narcotics Anonymous or Alcoholics Anonymous should be a strict requirement. Both of these programs helped save my life. Treatment facilities should be more accessible for addicts seeking help. Too often, I've seen addicts continue using because there aren't many facilities in the area. People should be allowed to get well. Low income addicts or those who lack health insurance should not be turned away. An addict desiring recovery should not be forced to remain in the horrors of addiction due to the inability to pay. I hope I have provided a lot of information and insight into the disease of addiction and the ways that it harms our communities. It isn't just an addict issue, it's an us issue. It affects families, it destroys homes and lives. Only through educating ourselves, providing accessible treatment, and overwhelming support can we hope to lessen the epidemic that ravages the U.S. today. Thank you.